I'm William Wallace. I am the owner of Fleming Island Plastic Surgery, board certified in plastic surgery, board certified in general surgery. Work towards providing aesthetic and reconstructive surgery to the Fleming Island area as well as Greater Jacksonville.
I read the reviews for Dr. Wallace and they were amazing. It made me feel very confident that I was going to the right person.
Everybody's so polite and you just felt comfortable, felt very comfortable.
From the moment you come into the end result to the intraoperative experience, I want it to be outstanding. I want it to be safe, I want it to be clean, I want it to be professional. I want them to know that their concerns were heard.
I really felt like I was treated like a VIP, like I was the only patient here, that no one else was even waiting to see him, that he spent all the time that he needed to talk to me and answer all the questions that I had. It was a very calm, relaxing experience all the way up until the surgery and even after.
He's gentle, but he's so thorough, and you know exactly what he's going to do, what you're going to feel, so there are no surprises.
My goal for every patient that walks through my door is to have as natural a result as we can. If you can tell someone's had work done to me, that's a bad job, and you can always identify the bad jobs. My goal is to have results with everything we do, where the patient, someone would come up to them, say, "You look fantastic. If you lost weight, if you've been on vacation," they know something's been done, but they can't figure out what it is.
I knew as soon as I was done, it was just, I was happy.
If I ever have any elective surgeries again, I would definitely come back here.
It really boils down to, my commitment to the patient. From start to finish, you're going to have a result that we're both going to be happy with. Breast augmentation is a very popular procedure. Historically, women would go to a plastic surgeon. The plastic surgeon would say, well, this is the implant that you're going to get, without a lot of interaction and involvement on the patient's part, patient's behalf to get there. And so they would get a good result, but it might not be the result they wanted. And so if they got a great result, but it's not the result they wanted, they won't be happy. It really boils down to making sure that the patient gets a result that they're happy with. Overwhelmingly, if you talk to our patients, they'll tell you that they just felt like we heard them. I really want to make sure that I understand what it is that they're wanting. The consultations that we offer are for breast augmentation or complimentary, because we know that it's a very popular procedure and patients are going to seek out multiple surgeons to see what's best for them, and they should. It is your body. You want to get it done right the first time.
He answered every question that I had, and he was very, very, very knowledgeable, great bedside manner, and from then I just knew he was the best, and I'm glad, really, really, really happy I went with him.
New breast augmentation patients that don't have an implant already, we do a sizing system. We pick out different types of sizes. Ultimately, the size you and I will come up with based on pictures, or if you don't have implants already, then we'll do a sizing system where we can actually put simulated implants in there to mock up a result. We have smooth implants. This is an extra high profile implant. This is a medium type profile implant. They call it moderate plus. And then there's some textured implants that can be there for an array of purposes. This actually has a shape to it, so it looks more like a natural breast upon insertion, just to get those results that the patient wants. Wow, that was fantastic! Here comes the next video. Another procedure we do a lot of is a tummy tuck or abdominoplasty. Standard patient that comes in for that is going to be typically a woman of childbearing age, has had some pregnancy, has had some skin, maybe some muscle that has stretched out, didn't go quite back the way she had anticipated. Sometimes there can be some fatty deposits and some trouble areas that just can't go away.
Well, after having 2 kids in my early 30s and then losing weight in my late 30s, I had a lot of stretched out skin that I couldn't ever tighten up with exercise or working out. No matter what I did, it was just there.
It's an outpatient procedure. It takes anywhere from about an hour and a half to 3 hours, depending on how much tummy we're tucking. Follow-up for tummy tucks is the same for most of my surgeries. We'll see them the day after surgery, the week after surgery, the month after surgery, 3 months after surgery.
I was confident in him and his staff taking care of me because he had explained it from the time I would go under to the time I would wake up through the recovery process of what to expect. From beginning to end, just a wonderful, wonderful experience.
As we take the binder and dressings down, they can typically see the improved contouring. If there was some extra skin and a bulge hanging over, they'll almost see that immediately. It will take about 6 weeks minimum to really get those final stages of swelling to go away. Bruising is usually gone within a couple weeks. Full return to all activity is going to be about 4 to 6 weeks. Most of the patients in this area are excited to go swimsuit shopping. That's a very common response. They haven't been able to wear a 2-piece since they had kids. So that's exciting. Any kind of stretch marks that are there before surgery, as long as they're below the belly button, typically will be eliminated with this surgery. So it can be really, really transformative. Liposuction remains the most popular cosmetic procedure performed in America. If you include men and women together, breast augmentation is most popular for women. Liposuction is the removal of fat from under the skin, typically surgical. There are some non-surgical options now, depending on the areas we're trying to achieve and the amount of fat that needs to be removed. Liposuction and non-surgical liposuction is going to rely on the skin quality to be in good condition. If the skin quality, the elasticity of the skin isn't good, then you can actually make things look worse. Think of an analogy I use is a balloon versus maybe a grocery bag. If you fill them both up with air, they both kind of look like balloons. You take out half the air in the balloon, it looks like a balloon. You take out half the air in a grocery bag, it doesn't look good at all. So the only way to make that look like a balloon again is to remove some of that bag or that skin. So that's where body contouring falls into play. You wouldn't want to offer liposuction to that patient. We get a lot of patients that come in that are hoping to achieve what they want through liposuction alone. That isn't always the case. I would much rather offer the patient the procedure that's right for them to get them the best result than to sometimes give a procedure to a patient that they might want that wouldn't give them a good result. Still watching? The next one's even better.
Hi, I'm Stacy. I'm the medical assistant here at Fleming Island Plastic Surgery.
Hi, I'm Maria Raphael, the nurse practitioner here at the practice. I wanted to talk to you a little bit more about Zeo Skin Health. It is a medical grade skincare line created by Dr. Zaino Baji. He is a well-known pathologist, dermatologist. He has been in practice for over 30 years, and he created this line in order to help everyone achieve healthy, beautiful skin.
What's really great about this product is that it's customizable for every single patient. So whether your concerns are pigmentation, acne, fine lines, and wrinkles, we can help you. When we first started using Zeo Skin Health, I actually had my mom try it for her pigmentation. She experienced a lot of pigmentation on her cheeks a couple of years ago after going boating, and it never disappeared. We put her on hydroquinone therapy, and after careful use of that for 3 months, she noticed a huge difference. There's no more pigmentation under her cheeks, her skin tone is even, and I've also noticed a difference in my skin as well. What makes Zeo different than any other skincare line is that they actually did clinical studies to show that just by using their cleansing, exfoliating, and toning products, just these 3 things, they have seen significant improvement in everything from pore size to texture repair as well as redness.
When you come in for a consultation, we go over what are your concerns, what is your goals. We customize that regimen towards your needs, and we also go step by step, showing you which product goes on first and also how to dose it properly so you get the best improvement, best results possible.
Every patient that has switched over to Zeo Skin Health has seen a significant improvement in their skin within 3 or 4 months of using it. So if you're ready to get started, just give our office a call and schedule a consultation.
Botox is going to be the big door opening to a lot of people into a plastic surgery practice. It is a medicine that will interrupt the signals from nerves acting on muscles so the muscles don't work as well. The muscles we are treating happen to be attached to the skin, so then those lines will go away. Fillers are just that. They fill out lines, so they're not inhibiting the motion of the area. They'll bring out deeper lines. I like to use Botox predominantly from the corners of the eye. Fillers then fill in the gap from the corners of the eyes down. In times past, we would fill the lines directly because that's where the problem was. We have realized through research that part of facial aging has not as much to do with the soft tissues as we thought, but actually with bony depletion. And that as we mature, we lose some bony volume in our cheeks, which then causes things to descend. So where we used to start at the bottom and work our way up, now we're starting at the top and working our way down to restore some facial volume through an injectable rather than surgery. And the results can be striking. You're still in the lobby? Hang on a second, we'll get you back shortly. Rhinoplasty is probably, I would say that's the most personal procedure that I offer. You know, nothing defines your face quite as much as your nose does. Most people don't like the way they look in photographs for one reason or another. Many times it's because they don't like their nose. When a patient comes in complaining or concerned about their appearance of the nose, you know, I spend a lot of time really talking to them about what's concerning them, if there's been injury, how they breathe, if they're having any trouble breathing, be it allergies or otherwise. Really want to talk about expectations. Even under the best of circumstances, the rate of revision for rhinoplasty or nose surgery reported nationwide is about 1 in 5. I think a lot of that really boils down to expectations of the patient versus outcomes from the surgeon. There's just missed that communication somewhere, so I really want to make sure we're on the same page. I'm probably fairly conservative in my outcomes. I'm not trying to transform anyone. I'm trying to improve upon what they've got. The best model I use for patients when we're trying to talk about what direction we want to go is my before and after pictures, you know, so they can kind of see, you know, what my results are looking like, to reassure them that the patient afterwards looks similar to the patient before, just improved. The transformations, while subtle, can be striking.
I knew as soon as I was done, it was just, I was happy.
If I ever have any elective surgeries again, I would definitely come back here.
Another popular procedure we see in Jacksonville is a mommy makeover. After pregnancy, after childbirth, there can be changes to a woman's body, breast, abdomen, through engorgement, enlargement from hormones, from expansion from childbirth, that afterwards just don't snap back to their pre-baby self. No matter how much diet, exercise, physical therapy that they try to go through, just may not achieve that result that they had before. When we say mommy makeover, it's really a catchphrase for rejuvenation of the breasts and abdomen. And that can really mean a lot of things. So again, the consultations can be very, very important. With breasts, we can make a breast bigger through an augmentation. We can make a breast smaller through a reduction. And we can make a breast shorter through a lift. And sometimes we can do a combination of those. With the abdomen, we can remove fat to make things thinner. We can do a skin removal or skin tightening. We can also do a muscle tightening. We really want to assess what those concerns are and what the canvas is like, because that can really influence what we need to do. But lumping the breasts and abdomen into a joint combined procedure is what we consider a mommy makeover.
Hi, I'm Simone.
And I'm Whitney.
And we're your patient liaisons. It was very nice meeting you at your consult.
We understand that plastic surgery can be a difficult decision, and we're here to answer any questions that you may have going forward.
Thank you for choosing Fleming Island Plastic Surgery
And Dr. William Wallace.
Bye.